is Al-khateib, and I would like to talk to you about my career specialty of a doctor of osteopathic medicine, or a DO. Today we're going to talk about understanding the career of a DO, how to become a DO, employment opportunities, some traits that make a good DO, and how this job will fit into the healthcare system. So, first we're going to start talking about understanding the career. Some of the things that a DO does is OMM, which is osteopathic manipulative medicine. Osteopathic manipulative medicine is a set of hands-on techniques to help prevent and alleviate pain. Next, we're going to talk about diagnosing a patient. Diagnosing a patient can be through following symptoms or running tests. And the next thing we're going to talk about is the treatment plan, which piggybacks on to diagnosing. After the treatment plan, it could be prescribing medicine or referring out to specialized doctors. And the last thing we're going to bring up for understanding is advocating. Advocating can mean many different things in the medical field, so yeah. Next, we're going to talk about how to become a DO. So what you're going to do to become a DO is you're going to attain a bachelor's degree or prerequisites. You don't have to have a bachelor's degree in science, but you will need your prerequisites to get accepted into medical school. Then you're going to go to medical school. Medical school would be an osteopathic medical school. In Oklahoma, we have OSU, College of Medicine. And then the next thing you're going to do is complete a residency. You are a DO out of medical school, but to practice, you need to complete a residency, which is 3 to 7 years. And then after residency, you can get a fellowship, which is usually 1 to 3 years, and it makes you more specialized, and you get extra letters behind your name. And then next, we're going to talk about employment opportunities. There's tons of ways to be employed as a DO. A few we're going to talk about is private practice. You can own your own practice and have patients come see you, and if it's over your head, you can refer out to a specialist. Another way is to be owned by a corporation and have a private practice. And then another way is to be contracted through a hospital and work at a hospital. And then another way is the military. There's very many options to work as a doctor in the military. Now we're going to go on to traits. Some good traits that I believe make a good DO is being able to communicate with your patients. Being a really good communicator seems to have helped. The next thing is you're going to want to be empathetic. You really want to be able to connect with your patient and have a good patient-doctor relationship. The next thing you're going to want to do is be confident. Patients will second guess your opinion if you don't seem confident. And then a last thing we're going to talk about is knowledgeable as a trait. You want to be able to know and explain why you're prescribing this medicine or diagnosing this disease. So finally, we're going to get to why this job, or how this job, fits into the healthcare system. This job fits into the healthcare system by working with other medical professionals such as nurses and physicians to diagnose and prescribe medication for a patient. A DO may refer a patient to a specialist, or they may be able to take care of it on its own. That's all I have for you guys today. Thank you.